I'm a cognitive psychologist, and my research program in general focuses on bilingualism and the cognitive aspects of bilingualism. For example, predicting proficiency in bilingualism, also looking at the cognitive consequences of bilingualism. So for me, this was a brand new area of research to bring what I know about bilingualism and now apply it in a way that can inform us on how to improve health Hispanic disparities research. And so I'm going to talk to you today about a strategy that we have used in our lab that's been designed to enable participants to, after being trained on the strategy, to better comprehend and recall health-related information. This is particularly important now more than ever, given particular budget cuts in public health entities. And also there is an increasing need on part of patients to inform themselves about decisions that they might have to make. And some unfortunate facts regard what you will see is a literacy gap, a marked literacy gap in Hispanic populations in the United States relative to other minority groups. Now, focusing on health literacy, here I just have a definition for you. It's the ability to obtain, process, and understand basic health information. These are basic skills that one needs such that if they're faced with a health-related decision, they need to be equipped with enough basic information to make a choice that is optimal for them. And here is an unfortunate statistic. This is showing the percentage of adults in the United States whose health literacy is below a basic level. And what you see on the left-hand side of the pie chart are those identified within minority populations. And within the different minority populations, what we find is the largest portion is accounted for by Hispanic portions of the population. So unfortunately, this was not surprising to me because I know within general education that there's a literacy gap, a significant literacy gap for Hispanic population relative to other minorities. As a matter of fact, it's one that we see from K through 12 all the way through higher ed. One of the biggest obstacles and for achieving a graduate degree or even an undergraduate degree in Hispanic populations has to do with literacy. So I already knew there was a literacy gap, and here we see it particularly in health literacy as well. And so what we wanted to know is there a way to significantly increase and improve access to health information by arming individuals with better strategies that will give them to a skill that will enable them to better handle text, things that they're reading about health. And we focused on a particular strategy developed at Penn State. I'm going to call it the TSS. That stands for Text Structure Strategy. It's actually, in spirit, it seems pretty simple. Basically what you do for people who are learning this strategy is you are guiding the reader to devote attention and to devote cognitive resources as they read to pay attention to how that text is being structured. So that when you read anything, if you're reading for information, if your goal for reading is to remember what you're reading for later on in lifetime use, what you want to do is pay attention to how that information is structured. For example, some texts are structured according to cause-effect, comparison, contrast. Some are structured according to chronological sequence. And so we teach readers to pay more attention to words. We call them signal words. Words that signal what structure the author is using. And what you're supposed to do while you're reading is take in the information according to that structure. And later on, you are to recall the information first using that structure. It sounds pretty simple. It doesn't sound like rocket science. And you might wonder, well, how effective can this reading strategy be for people who say, let's say, already have high levels of literacy? Well, I had the great fortune of being at Penn State for my graduate career and took a class with the author of this particular strategy. And as part of our course requirement, and we were doctoral students, was to take the strategy. And I was the least enthusiastic about it. I didn't think that we would gain anything from it. And lo and behold, after 6 hours of instruction spread over 2 weeks, my ability to recall information from expository text increased significantly. I didn't need to do a statistical test to see it because I could see how much more I was recalling. So this strategy has, it's very effective. It has documented success over 20 years worth. That's just a small sampling of the studies that have shown the effectiveness of this text structure strategy. We have seen its effectiveness across the lifespan. It's been tested with kindergartners even, or just immersion in literacy. It's been tested with 4th and 5th graders. It's been tested with older adults. It also shows great benefits for older adults, individuals 65 years and older who might be finding themselves having to make higher rate of health-related decisions. It shows that it also improves their ability to not only comprehend, but recall information from text. There's emerging work demonstrating that this strategy is also effective for non-native readers. So people who are reading in their less dominant, sometimes non-native language. And one emerging study in particular came from our lab. And we showed in this publication, it is published, I guess this past year, we looked at actually university students here at UTEP who were enrolled in the ESOL program. These are English speakers of other languages. So university students whose first language is not English, in this case they were, their native language was Spanish and they were more dominant in Spanish. And what we did was pretty straightforward design. We tested their ability to recall information from text at a pre-test. Then they took the text structure strategy, which overall is 4 sessions, each session lasting about 2 hours. And then we tested them again at post-test, and we did 2 things. Not only did we look at their ability to recall information from text, we also have some eye trackers in the lab. These are devices that allow us to measure what the eye movements readers are making as they read along, because we were wondering, you know, we have over 20 years of research showing this strategy works. We want to know why. What is it that the reader's doing differently when they've learned the strategy? A great way to look at that, instead of relying on people's phenomenology, what they think they're doing differently, you get more accurate information if you can kind of peek behind the scenes. And so we used eye movement monitoring to see how they were going through text differently after learning the strategy. Now let me just show you a visual. This is just a visual of the gains you will see in recall from this text structure strategy. Now remember, these are university students, granted reading in their non-dominant language, but nonetheless, these are individuals with relatively high proficiency, literacy. What you see is one particular participant's recall of a passage at pre-test in the blue ink, and then how much more they're able to recall at post-test. This is a representative example visual of the types of gains you see. It is very rewarding. We find it very rewarding in our laboratory to look at the post-test later on. As soon as the data's been collected, we haven't done the analyses yet. It's prior to getting exciting t-tests and seeing there's significant differences, statistically speaking, to see these increases. Now, in this particular study had nothing to do with health-related information. So it seemed logical to me to say, well, can this text structure strategy also be effective in allowing individuals to better process health-related information? And thus with the potential implication of reducing Hispanic health disparities, particularly in access to health information, by empowering them with a strategy that will let them better take in information related to health. We also found that in that prior study that not only did they show differences in recall, we looked at their eye movement patterns. The way they went through text changed significantly. I can't go too much detail, but basically what we saw was that at post-test, they weren't spending more time reading, so it's not like they learned to spend more time reading. Instead, they were more strategic. What we saw is that they were able to quickly discern, this is an important part of text, I'm going to pay attention to this. That's what we found, and that's published in 2010. But then what I did for the HHDRC grant was to now look at how the strategy might be demonstrated when we're talking about the reading of health-related information. And we wanted to know if we would see similar benefits in health literacy, and the data I'm going to show you in particular is this strategy instruction took place exclusively in the second language, English. What we wanted to do too was, in this extension, not only look at its impact with health literacy, but to wonder, will participants show transfer of these skills when reading in their dominant language, even though they didn't receive instruction in that language? will we see transfer? And so we recruited 48 Spanish-English bilinguals who were much more dominant in Spanish than English. They came from both UTEP as well as UACJ. Just a little anecdote to let you know that these participants found the strategy so interesting and useful, they would wait at the bridge crossing for over an hour at times for their 1-hour session. Extremely motivated. That was very rewarding for the lab in general to see that. Let me show you this quickly. I'm just going to let you know about their bilingualism real briefly. What I'm showing you here is how they rated their own proficiency in Spanish and English on a scale of 1 to 10. All I'm showing you here is that yes, they felt they were much more dominant in Spanish, 9.4 out of 10, versus 7.2. So these are Spanish-English bilinguals, clearly more dominant in Spanish than in English. They receive all the instruction in English. And I don't have too much time to go into this, but later you can ask me about what the curriculum's like in this text structure strategy. We've recently updated it. And so at pre-test, we had them read and recall 2 texts, one in English, one in Spanish. And here's the poor man's version of eye tracking, because it takes way too long to individually test people on an eye tracker when you have 48 people. So we gave them pencils, we gave them highlighters. Highlight what you think, as you're reading, just highlight. We had them do that at pre and post test. And then we asked them about their prior knowledge on health topics. We focused on the topic of pregnancy and prenatal health, assuming that many people, either vicariously or as the first person come into contact with this topic. And basically, as I said before, the strategy takes about 4 sessions, each lasting about 2 hours, and they also do homework. It's very interactive and fun. And then we post-tested them immediately after the last session of the strategy. And now what they were given at pre and post-test were 2 texts based on prenatal and pregnancy health, one in English, one in Spanish. And again, we asked them to underline, and we also looked at their gains and recall. What I'm going to show you is data, particularly regarding their underlining behavior, what they underlined from the text from pre to post-test. I will tell you just here that we saw significant gains, we weren't shocked, in their recall. Just show you real quickly. What we found was that we looked at the texts in Spanish, the L1, and we saw that, first of all, the readers, at pre versus post test, these participants underlined less. They did that less. They didn't rely so much on that strategy, which suggests to us they were relying more on this better strategy of paying attention to text structure instead of wasting time underlining things that won't help you. And remember, this is now in Spanish, even though all instruction was in English. What we found was that by post-test, they were underlining key words, words that signal the structure of the text they're reading at a significantly greater rate. They went from 5% at pre-test to 21% at post-test. This means that even though the texts were in Spanish and we never taught them the strategy, we never gave them example words in Spanish, they automatically, implicitly transferred use of the strategy into Spanish. So they showed great gains in recall. They showed that they were being more strategic readers. They weren't just wasting their time underlining stuff that's not going to help them. They were able to discern important areas of text. And currently we are doing more research on this right now, and we're looking at the relative benefits. What's the relative benefit of giving individuals a reading strategy versus how about just giving them a well-structured text? And later on I can talk to you about this. Basically, when we were developing the materials for this study, I was flabbergasted by the poor quality of texts available online, because that's where we got our pre and post-test texts from. They were hard for me to navigate through. And so what we're looking at now is what's the relative benefit of actually being equipped with this strategy versus getting a decently written piece of text about some health topic. And because I've run out of time, I'm just going to stop right here. Do I have any time for questions, or did I eat it all up? 2 minutes for questions. Since I had to go fast, feel free to ask anything.
How long did the training take?
Okay, so it was 4 sessions ranging from an hour and a half to 2 hours each one, and they were distributed over 2 weeks. And that actually turns out to be the big obstacle, is getting people to come back 4 times. So what we're going to try to do for the summer is get it where we bring them in just for an all-day thing, the break in the middle. Because that's been the biggest hindrance is can people come back 4 times.
Is it the kind of thing where you can really master it in a day, or is it more with more training do you a lot more good?
A lot more training would be a lot more good. But then again, to make this practical, how are, we can't mass give this to everyone in the community.
Well, I'm wondering if you're looking to maybe train maybe public health people that
Maybe, right?
Because then it is a lot of medical texts are poorly written. And
No,
just giving
exactly.
people who write the stuff the ability to see what people can.
Exactly. And so ideally, maybe possible, because I thought about this, like how do you mass apply this? There are certain structures that are used particularly in health topics, cause, effect, problem, solution. So maybe we can just focus the strategy on paying attention to those 2 structures. Those are the things we're brainstorming, how to make this more real, accessible, and relevant. As a matter of fact, another thing we want to do this summer is now go beyond the university population and see if we can run some sessions down at Damiano and other shelters for people who don't have the same access to education.
Is there any evidence that this training increases the oral presentation structure and abilities?
Now, in terms of writing, there's some. I'm less familiar with it.
I was thinking in terms of health education, if you provide health educators with this
That's a
training,
good idea.
would they provide better presentations to the community in terms of their overall organization and structure relative to those who didn't receive this?
That's a way to attack this I haven't thought of. That's actually a good idea.
Will you please talk about a little bit more about what is actually taught in these instruction sessions?
Yeah, so they're introduced to the fact that, hey, when people write, they're trying to tell you something, and they use a certain structure to do that. And so we get lots of examples, and then we tell them that in general, most texts can be accounted for by 5 different structures or plans, and they see, what they do is they work in groups, collaborative little groups, and they look at different, let's say, for example, magazine articles that illustrate the particular structure, and then they do things like read and recall texts. They quiz each other. They're asked to go home and find examples of different structures in magazines and the like. We recently, this year, extra appreciative for the funding, because what we did was, the curriculum we have was developed at Penn State, it was developed in the 1980s, and we needed to update that. So it had, advertisements from the 80s. And so what we did is we created this booklet now, that all of its materials and practice materials deal exclusively with pregnancy and prenatal health. And so we are releasing onto society these people now who have this specific expertise in pregnancy and prenatal, particularly women's reproductive health. They've learned a lot. We have the whole booklet there. Do I have time for just one little anecdote on that, actually? Oh, no, sure. Okay, just one little anecdote. One of the participants, he self-reported no knowledge of pregnancy, prenatal health, didn't know what estrogen was or progesterone. And then at post-test, after he received the strategy, he read a text that talked about different types of birth control pills. And then he's given this scenario. Here's a woman who has a history of breast cancer in the family. She's worried about synthetic estrogen. What should she do? And you see this participant just masterfully say, well, she should definitely take this pill because it doesn't have any estrogen. And so that's very rewarding. That's really fun. Thank you.